Okay. Can everybody see the QIC screen? Perfect. Okay. So welcome. I'm going to go off camera just so my bandwidth is a little bit better. So that will be why I'm off camera. Okay, so welcome to the second QIC meeting of 2022. Again, this meeting is being recorded. If you do not wish to be recorded, you may leave the meeting now. A recording of the meeting will be available via email as well as on the county website. Please feel free to ask any questions during each agenda item slide. And if you feel that we missed any important information or topics you think should be included in our next QIC meeting in September, please let us know and we can, discuss that and add them to the next meeting's agenda. Okay, we're going to start with grievances and changes of provider requests. This is for fiscal year 21-22. We're obviously almost done with this fiscal year at the end of this month. The total number of grievances to date right now is 17. 3 of those were opened this month in June and are therefore still pending. 2 of those that are pending, I think I'm able to resolve those before the end of the month. So we'll only have probably 1 pending into the next fiscal year. 3 grievances from this year that had a change of provider request as part of the resolution. So basically, in an attempt to resolve any issues and stuff with their concerns about staff, we were able to provide them with a change of provider, and that was helpful for them in resolving their grievance. Of those, not of those, but there was 1 change of provider request that mitigated the need for a formal grievance, which was basically I got a phone call. They told me what was going on. And instead of them filing an actual formal grievance, we were able to mitigate that with just doing a change of provider, and that solved the problem. So, and the number of change of provider requests that we had for the fiscal year was 8. Of these 8, 1 of them was a double. So technically there was 7, but 1 of them had 2 children from the same family. So I counted it as 8. And in those 8, the 3 that were grievances are part of that number as well. So sometimes they overlap. Sometimes all that needs to happen is a change of provider request instead of a grievance. But a lot of times the grievances are a little bit more involved, where only a change of provider is only a piece of what needs to happen. Does anybody have any questions? Perfect.
My only question is we just don't have a lot of providers to choose from.
That is a big concern. Currently, one of the grievances that I have open right now, we're seeing that a change of provider is necessary, but there's not, for certain parts of it, there's not a lot to choose from. So, it's tricky, but we're figuring it out in order to make sure that the client is receiving the best possible care and that they feel safe and heard. So that's a big part of what I'm trying to do with those negotiations with clinical. Okay. All right, so for our audits, we did this the last time in March. I just wanted to give some more information and some updates. So for our PSPP for the Lucerne Clinic, the CAP was submitted on March 2nd, and it was accepted by DHCS on June 20th. So that's awesome. And then the only follow-up actions we have is that our compliance team will send DHCS a document of proof showing that each CAP item is completed, at which point it will be fully resolved. For our DMC SABG, for fiscal year 2021, we had sent it in January, but it's still pending acceptance. However, our 21-22 findings report was received from DHCS in April. And our current cap for that is due on June 28th, so next week. And to give you a little bit more information about all of this, I'm going to turn it over to Rob Chalmers.
Good morning. Can everybody hear me?
Yes.
Okay. So the DHCS caps that are due on June 28th, those are the SAP DDMC, and those are on track to be sent in on June 28th. We have not had any major findings in quite a few years. I've noticed in the 2 to 3 years that I've been lead on the treatment audit, sorry. A lot of times in our closing meetings with DHCS, when they've finished their audit and they're getting ready to leave, they seem very pleased with our efforts to maintain our standards. So that's a good positive feeling when they're like, you did well. You know, we still expect findings, but then telling us we're doing well is a good feeling. I have noticed that for most of the corrections that they do send us, the findings, the corrections tend to be towards needing just staff training, reiterating policies with the policies and procedures with the staff. And the other trend is actually small changes to our actual policies. And to give you an example, 8 out of the 9 findings for the 21-22 DMC audit, 8 out of 9 of those just needed minor updates to the policies or a procedure. And the SABG, 4 out of the 6 findings needed minor updates to policy and procedure. So we can keep up with that, and we can continue to strive to maintain our standards.
Awesome. Thank you. Vanessa, I saw you had a hand up. Did you have a question?
Yeah, can you define the acronyms? That was a comment that was done in the chat. And then my other question was just to give us a synopsis of the CAP findings, which it sounds like Rob answered that in his response. So thank you.
So the acronym is PSPP, is a post-service post-payment audit. They come in and audit for correct billing. The progress notes are correct and up to the regulations. They contain the items that are required by the regulation in each of the notes. Clients are attending the correct amount of services required per month. They look at those types of things for the PSPS, the post-service post-payment. DMC and SABG, they come in drug medical and substance abuse block grant audit. Both of those tend to be a much more in-depth look at our policies and procedures, our contracts, basically that we're following all the state, federal, and local guidelines and regulations. And those are those audits.
And the CAPs are corrective action plans.
Correct. Thank you. DHCS is Department of Healthcare Services. On a side note, we just finished our corrective action plans for the DUI program, and that went very well too. Please,
Vanessa.
our audit. Thank you.
Sorry, guys. Just wanted to, are you also going to be going over the caps that we have going on with our contracted providers, or, you know, just basically how many there are, how many are still open, that kind of thing? Or is that not in this?
It's not in this, but that's actually a really good topic. we can definitely put that on the September QIC meeting and go into more depth on that. That would be
Okay.
great. Thank you for that.
Sure.
Okay. Before I go away from audits, does anybody have any other questions? Good. Okay. All right, so the chart review process, following up from March, we're now at 11 charts that were reviewed between June 15, 2020 and February 15th, 2022. The common findings, again, our financial review form was not current or not on file. Progress notes were not completed in a timely manner. And then informed consent was not current or not on file. And with, sorry, I'm trying to get my breath because the next slide is a lot. With the implementation of the CalAIM, with the CalAIM documentation requirements, the review process is going to change and become a bit more streamlined going forward. So I'll jump right into CalAIM and what that's going to look like. This past April, DHCS sent out a bin number 22-019 in regards to the new documentation requirements for all specialty mental health, drug Medi-Cal, and drug Medi-Cal organized delivery system, or DMC ODS. It's in an effort to streamline documentation. So the purpose of this reformatting of documentation is to reform the behavioral health documentation requirements in an effort to improve the beneficiary experience, to effectively document treatment goals and outcomes, promote the delivery of person-centered care, promote safe, appropriate, and effective beneficiary care, address equity and disparities, and ensure quality and program integrity. So DHCS will monitor plans in counties for compliance with these documentation standards. Any deviations from the standards will result in the county receiving a corrective action plan, or a CAP. The documentation standards were outlined by DHCS in that bin. The first part is standardized assessment requirements. So basically, there's going to be stricter guidelines as to what those requirements are for the assessments of new clients. The second part, and this is where chart reviews fall, specialty mental health services assessment domain requirements. Within this, there are going to be 7 domains. The first domain includes presenting problems, current mental status, history of presenting problems, and beneficiary identified impairments. The second domain is just trauma, which, as we all can imagine, is significant enough for its own domain. The third domain is behavioral health history and the comorbidity. The fourth domain is medical history, current medications, comorbidity with behavioral health. The fifth domain is social and life circumstances and culture, religion, and spirituality, which is extremely important in treating clients. The sixth domain is strengths, risk behaviors, and safety factors. And the final domain is clinical summary and recommendations, diagnostic impression, medical necessity determination, level of care, and access criteria. So those domains will definitely help keep charts more streamlined. And so obviously going forward with these requirements, chart review process will be a little bit more, what's a good word? More direct. The other requirements for documentation is going to be the problem list, which is made up of symptoms, conditions, diagnosis, and or risk factors, progress notes, treatment and care planning requirements, and then telehealth consent. So with these requirements, things are going to be quite a bit more streamlined and very, this outline is very clear on what needs to go where. So does anybody have any questions? Jamie, this your.
It's really just a comment that under the domain number 3, behavioral health history, comorbidity, that's just another nice way of saying also the SUD issues that, you know, can sort of affect each other. And
Yes.
because it's just not clearly said as SUD, I just wanted to clarify that.
For sure. I was just taking it off the bin, and in my mind, I knew that it was co-occurring, and I should have added that. So thank you for explaining that to everyone. Scott?
Yeah, I had a question about how are we going to do these, like with our electronic health record? Are we, particularly like the assessment and the problem list, or is that going to be, how's that going to work? Have we figured that out?
I'm not entirely sure. I do know that they are rolling out things next month in July, the documentation requirements and stuff like that. So I have a feeling that DHCS will be rolling out a better explanation of how things are going to work. I do have an email with the bin, I think, that has things for Anasazi in it, and I can shoot that over to you or include it in the email with this video afterwards, if that would work. I haven't looked at everything in it, but that might answer some questions.
Okay. Yeah, and I did hear that they're going to have a standard statewide assessment, which would be new. I just wondered how we'll integrate that into our electronic health record.
So we have a vendor, Kingsview, that we've been working with to institute the changes in our electronic health record for these changes.
Okay, so they're on top of it then.
They are. It's a little bit slow moving because the information coming from the state is a bit vague, but it looks like they're on track. So more information to come to staff as in regards to the changes in the system.
So they'll get it all up to date just as we leave them.
Yeah. And we may have to institute some interim processes to make it work, because I believe we are required to start this July 1st.
Yeah, like next week.
Mm-hmm.
Yeah, that's correct, Vanessa. And yeah, it's unfortunate that we're going to have to sort of stitch this together somehow for a short period of time until we get our new electronic health record system. But rest assured, this is all being taken into consideration for the new EHR. But yeah, for now, I mean, it's unfortunate we're going to have to spend a bit of time to figure this out, but it is what it is, I guess.
Great, thank you, everyone. All right, so from our discharge planning team, we have some exciting news. The team is preparing to bring at least 5 clients back home to Lake County from their placement outside of the county, which is amazing. And there are multiple more clients who are ready for a lower level of care, which is fantastic. And then the team will be making referrals over to Manzanita House, and we'll be bringing clients home by the end of July or early August. So that's fantastic progress with our discharge planning team and working with those clients that are conserved and placed out of county. Lori or Jamie, do you have anything you want to add, or?
I'm not really. We're just super excited. This is a huge move in the right direction. Our clients have worked hard, and this is one of the biggest moves we've done in quite some time, bringing people home and into lower level of care. So we're super excied about it.
Awesome, thank
Yeah.
you.
Super
Jamie,
duper excited.
Super excited. Jamie, do you have anything?
Nope. All right. That is awesome news. All right. So their consumer satisfaction surveys, which took place between May 16th and May 20th. Approximately 118 LCBHS clients and families were called. 30 of those agreed to participate in the survey. They chose online. Unfortunately, only 10% of them completed the survey, which, if you're good at math, that's 3 people. However, RCS did provide us with 6 paper surveys. I take responsibility. I don't think I was clear with my expectations of the peer support centers to give people that walk into the centers the paper surveys or offer them to do it online. So we had none from the peer support centers. However, changes for next year, I will be asking that the peer support centers to offer the online and paper surveys to those who come into the centers during the survey week. This will obviously increase the number of surveys, hopefully, that are completed either online or on paper. Kimberly, do you have a question?
Well, so I believe the harbor, in fact, I know the harbor did surveys.
Yeah, that's where we got it from.
Okay, those were the harbor
Yes.
surveys. Okay, because I know that Christy, our analyst, was like, had tried to get some, and I wasn't sure if that was hers or ours. So, okay.
No,
same deal.
those were hers. I went and picked those up and mailed those out. Those were the only paper surveys. So I was very grateful to you guys for doing that.
Great. Okay.
Yeah, next
Thank you.
year, hopefully, we can get the other peer support centers to help as well. But I did actually have a phone call from one of the coordinators of this. I thought it was a scam call because they had a Beverly Hills phone number. But she said it was totally fine. A lot of counties were struggling, especially still with COVID. So it wasn't a big deal. They were very happy either way, even though it was a low number. And so we're hopeful for next year to have a better turnout for everything. But again, shout out to RCS for providing us with those paper surveys. Does anybody have any questions? Good. Okay, so topics for next time. And I will add more discussion about the caps with outside providers that Vanessa brought up, which is awesome. The other topics that I have earmarked are the Specialty Mental Health Services Implementation Plan, some performance outcome measures, and clinical assessment tools from our clinical team. Does anybody have anything else that they want to discuss? Where did everyone go?
You mean now or then?
I mean, anything that you guys want, would like to see on the agenda for our next meeting in September, sorry. No, all right.
But I'm sure that if you have something you want to discuss now, this time is protected.
For sure.
So do you have anything, Jamie?
You know, I had a comment about the chart reviews, but we sort of went on to the CalAIM stuff, which
Yeah,
is
go
very
for it.
important.
Do you want me to go back to that slide?
I
No?
don't think so. So the deal with the chart reviews is we had an old form that was just horrible, and I literally had zero time to ever get around to it. So we adopted a form from San Bernardino, anyway, a different county that was much, much better. And we were using it, and actually our crisis team, when they have a little bit of a downtime, if they don't have crisis calls, they were the ones who were actually doing the chart reviews. And the problem with the chart review is that, say, the question would be, you know, is there a mental health assessment done every year in a timely manner or whatever? And the problem is that at that time, our policy didn't state that it needed to be every year. So they, you know, it didn't match up with our exact policy, I guess is what I'm trying to say. So there were some very, like, people didn't know how to answer some of the questions. Since then, our policy has been made more clear, which is great. However, now we're getting into the CalAIM changes in all the documentation. So everything shifts again. And that's, I guess that's just what I wanted to acknowledge, is that, you know, it feels like things don't match up because things are always shifting, but at least we're getting some of them done. And the great thing about them is we can do them completely randomly, which means that it can be any one of our charts or any one of, you know, one of our contracted providers charts, RCS or LCUOE or whatever. So that part's really cool. Anyway, that's all. Thank you.
Awesome. Thank you, Jamie. Todd, you had a question or wanted to say something?
This is probably a really stupid question, but because I've jumped in and out of these meetings over time. What is the mission or purpose of this group? I mean, is this some mandated thing we have to do? I mean, because I'm enjoying the conversation. I'm just curious what the purpose of these meetings are.
So it's for quality improvement. So we're here to strive towards quality improvement. We should be showing more. I'm thinking we might need some more outcome measures, like with regard to the chart reviews, if we could discuss findings that we're finding so that we can find trends. And this group steers that problem solving that we do in order to create policy changes and so forth.
Well, for the chart reviews, we definitely have the findings with the financial forms and stuff like that. I think once we start to move forward with the CalAIM requirements and we get more chart reviews going, we'll start to be able to see more trends and hopefully correct those, just so we're in compliance all the time. Todd, since Vanessa gave me, I'm the chair of the QIC, so the Quality Improvement Committee now. So like basically my goal for this is to keep things on our end transparent, but also positive when able. But yeah, I think that going forward, as far as the chart reviews, we'll be able to have more trends seen, and hopefully with these, I don't want to say rigid documentation requirements, but very clear documentation requirements. Hopefully we'll see less findings of inadequacy and more findings of compliance.
Well, and the idea of quality improvement is the constant striving for improvement, right? So as we clear up some deficiencies or some findings, then we get to shift our trajectory toward what the next area of improvement is. And that's primarily what this committee is all about. However, it's probably, I think you brought up a really good point about, focusing on the mission for the committee and for this meeting. So maybe in the next set of slides, we could include a little synopsis of the QIC mission.
I love a good mission and vision statement. So yes, I like that.
It's in our QI work plan.
Perfect.
Oh, thank you. I didn't mean to get us off topic, but because I appreciate this and I love being able to be a part of these meetings, but I get this kind of mixed up with QAPI and
Which is at
other-
1:30 today.
Yeah, I know, it's on my calendar too. So I mean, I get the whole quality improvement thing. I mean, that's what we need to be working towards. And Kate, I appreciate your sense of humor about, sometimes it's good, sometimes it's bad, or it's ugly. But no, I was just curious. And again, it's my fault because I don't always make it to these meetings. So I kind of lost track of
But the
what we're doing.
QIC, one of the main purposes is that we present that quality improvement to the community
Mhm.
and be able to get community feedback as well.
Yes.
So it's that transparency, that we have. And whereas the QAPI meeting is more of an internal meeting, we do a lot more of the work.
And then for the September meeting, I am going to partner up with Patty Russell, and she's going to send all of our information for QIC out to their big MHSA email roster. So we'll hopefully have a bigger turnout for that. So MHSA has been really helpful with getting the word out and trying to make these meetings a little bit more accessible to other people in the community. So I appreciate that.
Well, I'm also thinking, and I haven't run this past our mental health advisory board, but I think they might be interested in if they can, participating in this as well.
Yes, they are strongly encouraged to.
But I don't think they're on the invite list. So
But they are on the larger
They're on-
MHSA.
yeah.
they would be on that. Yeah. Okay. Perfect.
So for our
That's a
September,
very large list.
Yeah.
for our September meeting, since they are going to be sending it out to their bigger list, I think that some of the topics that we covered today, and then some of the topics that we covered back in March, we'll have them updated and put on that agenda as well, just so we can see, so people that are coming in will have a little bit more information, and we'll also get that mission statement going and a little bit more refined.
No, that sounds good. Thank you, Kate and Vanessa and Patty.
I think Rob has a comment.
Yeah, so Todd, your original question is like, are we mandated to do these meetings? We're mandated to do quality assurance and performance improvement. So what Scott's saying is we're doing the QAPI is the internal, we're finding stuff, we're fixing it, that type of thing. And then I'm sure QIC came around as the transparency with the public and with staff.
It's
So
also
we
a mandate.
we are regulated to do quality improvement.
We're also mandated to have this meeting.
Yeah, I figured that, but that's why I said it was a dumb question.
It's not.
Never a dumb question.
Ever.
If there's nothing else, I just wanted to say thank you for joining us. Hopefully our next QIC meeting will be a little bit more robust with more people participating. The next QIC meeting will be held the week after QAPI on Thursday, September 29th, again at 10 a.m. I will be sending out, well, Patty actually will be sending out the Zoom invitation and agenda approximately a month before. Knowing me, it'll probably be closer to 2 months in advance. So keep an eye out for that. And if there's nothing else, we can end.
Thank you, Kate.
Thank you, Kate.
You are very welcome.
Thank you.
I hope
Bye.
everyone has a good day.
Thank you.
Thank you.
Bye.